Lens replacement can treat anyone who wants to make their vision better. Lens replacement is traditionally done for people who are presbyopic, for example, people who need to wear glasses for reading, so usually people above the age of 45, where we can give you good, clear vision without the need for spectacles. Anyone who wears spectacles and contact lenses above that age of 45 who doesn't want to wear them or wants to have that vision but without the need for spectacles should consider lens replacement surgery as a procedure, because it will mimic what vision you have with your spectacles, if not even improving your vision in many cases, particularly if your lens, your natural lens, has got cloudier, i.e. you're developing a cataract. So anyone who's developing a cataract who wants to make their vision better and also remove or reduce their requirement on spectacles can consider lens replacement surgery. Lens replacement surgery can also benefit certain conditions with specialized lenses. So there are specialized lenses which will improve, for example, your vision if you've got macular conditions. So many elderly people get age-related macular degeneration, and nowadays there are specialized lenses that may be suitable for certain patients to improve their vision by magnifying the actual image that you're seeing. There are different types of lenses available, and they're not suitable for all, but that's a discussion you can have with your surgeon and find out what's suitable for you.